Hello, everyone. Welcome back to our monthly clinical trials show here at BDO. I'm Taylin, your clinical trials editor here at blackdoctor.org, and I'm so happy to have my esteemed guest, Kianta Key, live with me. Nice to see you, Kianta.
Hello, Taylin. Glad to be here. Thank you for the invite.
Yes, of course. So Kianta is the group senior vice president and identity experience lead at GCI Health, which is an integrated healthcare communications agency. And she's also the lead investigator of a report called Layered, which focuses on Black women in clinical trials, which is what we're here to discuss today. So, Kianta, can you tell me a little bit about what your role at GCI Health encompasses?
Yeah, so thank you for the invitation. My role is sort of layered, which is also the title of the report you just talked about. But we try to focus on how can we make cultural first sort of communications. And that means how can we resonate with people? I think it's one thing to, put a message out there, but if the people you want to have hear it, aren't listening, aren't interested, then what are we doing, right? And I think this is especially important when we look at health. We want to make sure, again, we are getting into the communities and making sure we're creating something that will actually resonate with them. I've been fortunate to also be a part of our clinical trials team. And it has been a wild ride in a good way. Being able to take digital communications and then marry it with clinical trials has been really fulfilling work, especially when you think about the future of medicine and making sure that it looks like people like us. So I have been passionate about how to bridge sort of cultural first digital communications to drive clinical trials forward.
Awesome. So, I guess tell us the story behind how this report came about and especially how it got the name Layered.
Yes. So it started with my mom, actually. A lot of things start with my mom, obviously. But I was working one day. She was being nosy and she asked me what I was working on. And it was actually a clinical trial for people over 65 with an eye condition. And she, asked me what I was doing. I said I was working on this thing. And I asked her, hey, have you ever been asked to be a part of a clinical trial? And she said no. And then I said, well, Grandma, has she ever been asked to be a part of a clinical trial? She said no. And I said, well, if you were asked, would you participate in a clinical trial? And she said, yes. I want to, if I'm able to help someone else, that feels like, a win. So I was thinking about how 3 generations of Black women, myself, my mom, and my grandmother have never been asked to participate in a clinical trial, even though we all live with, chronic conditions. And I think the other part is that sometimes when you're in certain rooms, people make assumptions about communities, about, their likes, dislikes, what they will or will not do. And so you kept hearing, or I kept hearing, Black women and Black people are not interested in participating in a clinical trial. And I was like, well, my mom just said she would participate in a clinical trial. So I wanted to be able to sort of counter the assumptions by offering up some data, by offering up some truth, even if it's just a sample size. So our team at GCI, we put together a survey online. And we talked to 500 Black women between 1880 across the U.S., 38 states, I think, to be exact. And we asked them questions like, have you ever been asked to participate in a clinical trial? Who would influence you to participate in a clinical trial? And I think it came a lot of things you probably wouldn't be surprised by. But there were also some surprises in terms of just like the intersectional data, right? That just because you're a Black woman does not mean you will think the same way or have the same influences. So that's why we said it was layered, right? That it's a yes and it's not Black or white. It's sort of in this gray. And so when we apply communications, and I would think any sort of solutions, that it has to be layered. It can't be one thing and we don't, do other things, that it has to be multifaceted. So layered was also something I was thinking about just in terms of like collages and art I was inspired by a Black woman artist as well. And so thinking about that from like a creative perspective is also how we landed on Layered. That these many pieces end up becoming this masterpiece. So that was the motivation behind Layered. So it's been fun sort of talking about it. And again, just sort of offering a counter to the narrative that we've been hearing for a while.
Yes, I love that. And I like that you touched on like so many Black women haven't been asked. Actually, your report says that 73% of Black
Yes.
women surveyed have never been asked to participate in a clinical trial. Why do you
That's
think
right.
that is?
It's layered, right? So I think that number one, I saw a quote the other day on LinkedIn. Someone talked about race showing up. Race will show up in the doctor's office, but it's up to the provider to make sure that racism doesn't, it present as well, right? And so we can understand who people are, but we shouldn't layer our biases into what we think they are or stereotypes. And so I do think there has been there has been this narrative that Black people don't want to participate in clinical trials, or if you participate, you might hurt our data, or, it's that, right? I also think, and I think just thinking about the modern medicine, model that we have, where you are um, maybe in your doctor's office for 10 or 15 minutes, right? There might not be a ton of time to talk about clinical trials, right? Which is why I think it's important to give Black women patients the information so that they can be able to ask those questions if they have time, or make more time. Say, doctor, I need to talk to you about this, and I think that one thing that's been coming up more recently is that a lot of providers just don't have the information themselves to be able to give advice around clinical trials. So it's fine that we're talking to patients, but we also need to talk to providers so that they understand, there's a clinical trial, in your neighborhood that could benefit people that you're treating for diabetes. Here's more information. But often, again, they don't have a ton of time. I think we also need to make sure we're feeding in information to them so that they're educated, and so that the patient isn't the only person coming in. They're kind of meeting together, because I think sometimes, even though they're doctors, right, we think they know all the things. They don't know all the things, right? They're human, right? They only have so much time, so much capacity, so many things are in their head. So what are the ways, again, we can just educate them and make sure everyone has all the information they need so we can make an informed decision together?
Definitely, definitely. Another thing that I caught in the report is that safety is such a big priority for Black women when it comes to participating in a clinical trial. So, what were some of those safety concerns that were brought up?
Oh, well, I think number one is side effects. Like, this is a new drug. I want to make sure that it is not a side effect that maybe I am uncomfortable with, or if you have a certain, you might have a certain job, you can't, have those side effects. So I think that was number one. Number two or three, I think, was around making sure that, you're monitoring me if I'm coming in, that staff will make sure that I'm good to go. I don't think what Black women lifted up in that survey were anything that, anyone else wouldn't think about if you're participating in a clinical trial, health research. But I do think it's interesting that another thing that Black women did say in terms of not participating, and I think this all goes back into safety, is the historical and contemporary mistreatment of Black people in the healthcare setting. And I think that's important. We shouldn't ignore that, right? We have to recognize that, sure, we can start Tuskegee and Henrietta Lacks, but there are contemporary issues when you look at maternal mortality. Even I was reading the other day about retinol and how it was tested on Black women's skin. We have to kind of hold hands on that and acknowledge that, and that was a safety issue, right? That those folks did not give informed consent. So I think that's all a part of how communications anyway can lend itself to educate folks and to say, there is a process for this now that will ensure and prioritizes your safety when you enter into a clinical trial.
You completely answered the next question that I was going to ask you, is like, how do these injustices kind of contribute to like the safety concerns that Black women have? But yes, it's so intersectional, it's so nuanced. So really thank you for bringing that up. The report also suggests that influencers are kind of big in encouraging particularly younger Black women in trying clinical trials. Can you tell me a little bit more about that? Like who exactly are these key influencers that are reaching Black women?
Well, I think we're actually, I can't tell you, but we are working on something exciting for a clinical trial for one of our partners at GCI. We're very excited about it. But I do think that in our research, Black women under 40, so that's millennials, Gen Z, said that they would be most influenced by influencers or celebrity or someone they follow on social media, right? So, we obviously as communicators want to take that information and apply it so that we can actually make sure that we are using the right folks, using the right levers to communicate. But I do think influencers can be given, if trained and there's an actual interest there, to talk about clinical trials. And what you could do is relate it back to something that they might be impacted by. We primarily think it's important to leverage the voices of patients who could be influencers, who are telling their story about diabetes, about sickle cell, because they do have that trust already built in with their community. But I also think it could be cool and something I would love to do. So if anyone's watching this, please reach out to me, to tag beauty influencers in terms of being able to talk about clinical trials. Because when you think about the science of beauty and skin, those things have to be tested before they go out into market, right? So it could be interesting to have folks who we wouldn't ordinarily hear talk about clinical trials or medicine, talk about it from their lens, to then sort of get folks to better understanding in their day to day. Because I think clinical trials can feel so high science and over there. But the reason why you see, the medicine in your pharmacy or even the beauty on the beauty aisle is because, it was tested before it got to you. So how can we make that connect? And I think beauty influencers could do a heavy lift for us.
For sure, for sure. So influencers aside, for older Black women, essentially their doctors and their care team are kind of the bigger influencers in helping them decide, do I want to try a clinical trial? So what do you think that healthcare providers, Black or non-Black, can do to help Black women feel more comfortable participating in clinical trials, aside from just informing them that clinical trials are even an option?
So I think that, number one, I think taking the time out to explain the safety is paramount, because especially, let's say you've gotten a diagnosis, like a cancer diagnosis, where there's a lot of uncertainty sometimes. I want to do this trial, but I'm not sure. So I do think having a conversation about safety is paramount. I also think having the conversation, Taylin, often we think about communications for clinical trials as a one-to-one, but it's really a one-to-many. And I think especially when you think about Black women, we have a network, we have a village, we have a family, right? So making sure that we're having these conversations about clinical trials, not just with the patient, but making sure, their caregivers, their care partners are also in the room, so that everyone really understands how much time might this take? What are the logistics involved as well? What are the ways that providers can try to answer as many questions about a clinical trial before someone does say yes? I will say that sometimes clinical trial sites, they do have folks who will help navigate you, so that you won't, you're not just making a decision, then you're kind of like, okay, what do I do next? There are places that have folks who will help you along the way. But I definitely understand that before you take that move and participate in a clinical trial, what are the things you maybe need to hear from your provider? So again, I will just say safety, you're good. I think the other part is making sure you're communicating that with the family, and then making sure that sort of that handoff. I'm still here for you, but that site has you, but you can always come back for questions. Making sure that door is open, because I think when we think about sometimes treatment is sort of like end to end, it's linear, but these things are kind of more a loop. You're always sort of in care in some capacity. So making sure, again, that the provider has that door open for communications throughout the process.
Great, great. So I want to talk more about other barriers to participation. So we know that not being asked is probably the biggest one, but what were some other findings that your report came through on as far as why Black women aren't participating in clinical trials at higher rates?
Well, I think asking yes is number one for sure. And I think the way that clinical trials are often designed has this sort of um, optimal sort of outlook. Like you have all the time in the world. You don't have a job. You don't need childcare or elder care. You live right next to the site. You don't need transportation support. You have the top health insurance. If anything happens, you're fine, right? They make a bunch of assumptions about the people that will be in the trial, right? And that's because a lot of times the trials are not designed for all people.
Right.
And so I think what you have now, thankfully, happening where companies recognize that, okay, we can't generalize the trial journey. So let's start from the trial design to make sure everyone who can participate in a trial can access it. So they're doing things like, typically you'll find a clinical trial site might be at a university center. But if we see that, a bunch of folks that live 50 miles outside of this, metro area could participate, but they can't because the travel site is too far, they do a few things. They might set up a satellite site, right? So that increases the likelihood of folks being able to get the care that they need. So I think transportation is a barrier, and I think it's an addressable one. I know Merck is working with a organization called TrialNetX. I think I'm saying that right. No, sorry, it's Greenfire. Sorry about that. And they provide sort of almost a voucher on a card for folks if they want to take an Uber or take a taxi to the trial site. So I think that is a way to, understand what the barrier is and then try to find a solution for it. I know a few organizations are saying, okay, care, like if oftentimes women, especially Black women, you're taking care of your kid or your grandkids, you're also maybe taking care of an aging parent. How do you kind of balance that while also prioritizing the care that you need? So a lot of organizations are trying to figure out, okay, could we have like someone come in and sit with the person or help you with pickups and drop-offs, that kind of a thing. You're also seeing at the same time, nutrition is important, especially when you're going through a clinical trial. So in what ways can, again, we help alleviate some of those barriers that would probably get you to say no to in the beginning. But if we're offering up solutions, we can hopefully get you to say yes, but also stay in the trial and complete the trial, because often we also see that people might say yes to a trial, but then life gets in the way and then they'll drop out of the trial. So the big thing is we want you to say yes, but we also want you to stay in the trial. So some of those barriers, I think, are important to lift up because we think about, again, clinical trials is here, it's high science, medicine, all of that, but it's also a reality, like the real lived experience. So again, how are we kind of crossing the two to make sure we're putting forth solutions that, again, will change the future of medicine? And I think that's critically important, especially when we think about the genetics and the epigenetics of just our world. We have to make sure, our participants are diverse and coming from different, walks of life.
How do you feel about, decentralized trials, or in lots of ways virtual trials, in ways that Black women can participate? So it's not so much of a transportation barrier.
I think it's a great idea. My only thing sometimes with our tendency to go virtual with everything and put AI on everything, I think it's what is it? A chaotic good, right? Or even a chaotic neutral to a degree, because what you don't want to do is lean so heavily on technology if folks can't access it. Another issue you might find is just Wi-Fi, access is not created equal. Everyone does not have, the built infrastructure in all communities. So to rely on that too much, I would say, you put it in the right places, but I wouldn't say it's like the ultimate solution. I personally love the idea of decentralized trials. I remember a few weeks ago we were at Scope. There was this presentation, and it wasn't around like Black women, but it was focused on Indigenous communities and how they were using sort of these mobile units to, go into communities that were pretty far away from central or metro places like Billings, and being able to set up trial sites there. And I think again, when you are experiencing diagnosis and you're going into a trial, it's a very I would say scary moment, right? And so you probably want some sort of human to human connection to make sure I'm good, I'm still here, I'm still I'm taking this medicine, I'm taking this treatment, and someone is here monitoring me again, because that goes back to safety versus sometimes relying too heavily on a virtual to virtual connection.
No, that makes perfect sense. That makes perfect sense. So I want to bridge into, I guess, education around clinical trials. I definitely think that there's not, there's not always the most culturally appropriate language when it comes to discussing clinical trials with Black women.
Yes.
And it still often leaves us feeling as if, are we going to be treated like guinea pigs, or this is so high level? So I guess based on your research, what are some better ways to communicate and educate around clinical trials for Black women?
Well, I'll say this. I think that, and I was actually just on a call with Kimberly Richardson of the Black Cancer Collaborative. So shout out to her. I don't know if she's watching or watch later. But one of the things she often says, or when we were talking about sort of this research, is how can we tell the stories of people who've participated in a clinical trial and had a positive experience, and then talk about why others should participate. So how can we frame it so that someone could say, I'm still here because of research, right? And I think if you participate in this clinical trial, that you could have maybe a similar experience. I'm not saying that they will say, oh, you'll be fine, you'll be great. But I think what we have to do is find the voices who are on the same journey as you, who've had a positive experience about clinical trials, and to lift their voices up. I also think this one woman I was on a panel with a few months ago, Regina Barnes. Again, I don't know if she's listening, but hey, Regina, a breast cancer survivor. And she talked about participating in a clinical trial. Unfortunately, her cancer did relapse, and she did have to, take another drug or another treatment. But she said she ended up taking a treatment that she was on a clinical trial for like before. So it's almost like by you participating in now, you're creating clinical trials the medicine of the future. So I also just think about that as like, how can we like Black women are innovators. Like we do it all. Music, okay, politics, we can do it all. Food, we can do anything. And so it'd be amazing to just talk about sort of the power of our genes and how we can help contribute to, the future of medicine. And I know that, the story around Henrietta Lacks is a difficult story, especially when you think about she did not give consent for her cells. And I think about the power of her cells, right? That it created a vaccine for 1 billion people, right? That's one woman, one body. So if we think about and embrace that and say, we are powerful, we know the things, it's in us, it's in our DNA, it's coded, it's in our genes. I think that is a powerful, story to tell, and to, maybe get Black women to participate. But again, it's like acknowledging a thing and being honest, but then also lifting up the folks who participated before as sort of messengers or ambassadors or influencers, as the kids say.
No, I agree with you. And part of my day-to-day job is to find these, these really compelling clinical trial stories to just kind of bridge that understanding and answer some questions that a lot of people may have around, clinical trials and why someone would participate and just the amazing benefits that can come with it. So that's really great. I know you mentioned briefly, taking this sort of yes and approach when it comes to, reaching Black women about clinical trials. So can you give any examples of like this approach, this multi-channel approach?
Yeah, I think, well, what I always like to start with is the data. Like, what is the data telling me in terms of who is being diagnosed, maybe where they live, that kind of a thing. Because then I feel like, because I've lived in Atlanta, I'm from Atlanta, I lived in New York, and I lived in Miami. And Black women are similar, but they are very different, if you go to any of those cities, right?
Yes.
And so if you look at, let's say you're looking at breast cancer rates, and you're finding that, in New York, it is Black women between 40 and 49, right? But in Atlanta, it might be Black women who are 65 plus, who, have blue collar jobs, right? In Miami, you might find, for whatever reason, we're seeing a spike in, women under 40 with breast cancer. Those are 3 different campaigns in my mind. Sure, there could be a red thread, a campaign around, clinical trial participation, but the visuals might look different. You might, in New York, maybe there's some sort of subway component, someone walking, sidewalk, that kind of a thing. Versus in Miami, there could be a different feel. There's a large Black Caribbean community there. Maybe you add in some Creole, some Spanish for Afro Latinas. So I think that when we're talking about setting up a campaign to reach Black women, we have to start off again with the data, who's being impacted by that condition, where they are. That matters to me, because I hate seeing sort of ads or television shows. They're in the South or in New Orleans, especially, and there's no New Orleans accent. They have a very distinct accent.
Yeah.
You can't hear it. Please fake it, even if you don't have it. But I think that's so important, because when you hear someone who sounds like you, not just someone who looks like you, you again, going back to resonance, we want things to resonate. So I think that is crucial to start off with. But first, we have to understand the data. Now, I will say that our data sources are not very intersectional, that they do just sort of lend themselves to, Black, white, man, woman. Sometimes they don't include things like age. Well, most times they do age, but even sometimes location is off, because each state might have different reporting sort of mechanisms. So we do have, I think, gaps in the data, but with what we do have, we should lean on it, because I think that makes the messaging richer, it makes the visuals richer, and I think we get better outcomes on our end anyway when we talk about what we're measuring for, right? So not just clicks to the website, but did they actually make an action, right? Did they sign up to learn more about the clinical trial? that kind of a thing. So I hope I
Mhm.
answered your question. I know I just probably came up with the entire campaign.
No, that's very solid. It's about recognizing that Black women are not a monolith. We're
That's right.
very different in so many different areas and walks of life. So that's a very solid way to approach it.
Yep.
So I guess all that to be said, how can Black media companies like, BDO, for example, be kind of leveraged in those kinds of campaigns and outreach?
Yeah, I think first of all, I love that you all already have this sort of platform to talk about specifically clinical trials because we are needed in medicine, right? I think what I would personally love to see more of, especially just from a local level, what are the ways we can like incorporate BDO into, um, Bible study, right?
Hmm.
Is there a moment like, once a quarter, across Kojic or AME or NOI, right? That we are taking, your Bible study, your course over to talk about health and to talk about clinical trials and why it matters and to just be able to answer the questions folks might have because we might assume you know what a clinical trial is, but some people might not know what it is, right? But people know what cancer is, right? People know what diabetes is. So what are the ways again that I think we can become more integrated? Because I think you think about scale, and I think that's important. And again, I think our digital sort of our digital generation and all of that have allowed us to scale. And I think we can't forget that we need to sometimes just do the one-to-one, the one-to-one in your face in real life, IRL, so that people really understand the message that we're trying to hit home. And I think you all already have, the different diseases and conditions and things like that. I also think, as we're talking about influencers, there are a lot of local folks that I feel like y'all are connected to who could also post about, hey, this thing is happening with Atlanta native Kianta Key. Check it out. You know what I mean? So I think y'all are doing a lot. I know this work is it's hard work and it's hard work. And I think that the way we get to depth is by going back into community. So I would love to see more of that. I'm happy to be your Atlanta ambassador and bring all the people in. Um,
Beautiful. That's beautiful. Now, I definitely think that, post COVID,
yeah,
it's getting a little bit more difficult to kind of bring these digital experiences. Like, I mean, BDO has its own full digital ecosystem, but it's so hard to kind of step out of that box a little bit and realize we do have a physical community that we need to nurture.
that's
So
right.
that's a really great way to approach it. So
That's
thank you for that tip.
yes, and it's layered, right, Taylor?
Yes, for sure. It's that yes and.
Yes.
So, what steps do you think can be taken to kind of build or rebuild the trust like that the healthcare industry is kind of losing with the Black community? I mean, right now, you can look broadly and
Yeah.
see what's going on with kind of our healthcare system. So, what are some steps that you think can be taken to kind of build that trust back up?
Build the trust back up. That's an interesting phrase because that assumes that the trust was there in the first place.
Mm,
So I'm kidding, but I do think that there is an assumption that Black people just don't trust their doctor, right? And I
mhm,
don't think that's true. I think I was looking at a study, not my own, but I was looking at a study around um, who Black people sort of rely on in terms of talking about their health. And I think the number one answer is still their doctor, their provider, right?
mhm.
Um, and I think what ends up happening is it's almost kind of like a Google review, right? At a restaurant. You see or hear one bad review and then other people kind of pile on, and it's like, well, it's a 2.0 sort of restaurant. They shut down all the things. And I don't think that is, I'm not trying to say that's exactly what's happening, but I do think we do hear one thing and we say, well, I'm just not going to go to the doctor. I'm just going to opt out of care. I'm not going to do things I need to do to put myself in the best wellness sort of moment that I can be in. And I think that what we have to do for ourselves, right, is still make those appointments. And if there is a doctor that you are not comfortable with, change the doctor. Go to another doctor. Health and Her Hue has a whole platform for Black women that if you want to find a Black woman who is, specializing in gynecology or endocrinology, you can find her in your area. So I would say change your doctor. The other thing I would say is that, and again, this is just advocacy, right? We can't change the color or the culture of our providers. But what we have to do is make sure we are getting the best care that we can get. And that means we have to demand or ask for it sometimes. And I think, again, it's easy for us to do it like, again, going back to restaurants, maybe I'm hungry. But when you are dissatisfied with your meal, you say something. You're not going to eat a bad meal, but you complain, right? You say, hey, I need something else, or I want my money back. You communicate, right? And so we have to take that same audacity, that same courage into the doctor's office and say, hey, I don't understand this. Or look, you're my person and I need you to do these things for me because I want to be here for the next 100 years. How do we get there? What is the plan? What is the roadmap? And so I do think we need to be courageous when we go into the doctor's office. I think for whatever reason, we have a tendency to draw up. We don't want to ask the questions. I would say write the questions down. If you are not clear on something or you want to learn more about a clinical trial, ask the questions. Mm-hmm. And again, going back to number one, if you are not liking what you're seeing, change your doctor. But we have to speak up. But I think, this is a relationship, right? So trust is two-way. So I think that's what we can do for us. Now, how the medical healthcare industry attempts to win us back, I think that I'll say this for doctors, they are overworked. And the model right now is just not what it needs to be, okay? Now, having said that, I do think before they let you go, they can say, okay, let's talk about any of your concerns. What are you thinking? What does your life look like a year from now, 5 years from now? Because I think when we start talking about, again, science and medicine, it gets scary. But if I say, hey, I want to have a baby in a year, what do I need to do to get to that next level? Or do you have if you wrote down, you have a family history of hypertension, okay, I see your levels are this. How can we talk about sort of changes? Or, I understand that my family is this or that. Relationship means you have to relate, right? So doctors need to be able to relate to patients in order to get that trust back. And I think the other part is making sure that, not only time, but I also think that being transparent about, the overall experience, especially cost, I think that's going to matter more now. So in what ways their receptionist or whomever could just be clear, about costs, insurance changes. I know that's not their job, but hey, I'm now here with you. So I need you to maybe take some time to really help me understand sort of what's going on from a cost perspective. Again, Taylin, this is layered,
Layered. No, it's like several layers of a cake that you just got through.
Right. There are a lot of solutions, lots of problems, but I think that, to your point, we have to acknowledge that there is a trust issue. And when again, if your partner does not trust you, you're going to try to figure out why that is, right?
Right.
Maybe you did something right. And even if it wasn't you, maybe you kind of just want to clear the air. And I think that's about being transparent. I think it's about relating to each other and ultimately communication.
For sure. That was an amazing answer to a very layered question.
I did my best.
So, what would you say were some of the limitations of putting together this report, and how do you think this kind of paves the way for future research?
I would say that we only surveyed 500 Black women, and I think there are 17 million Black women in the U.S. I think that's the right number. Shout out to Girl Trek. I was on a call with them last week for Harriet Tubman Day, and they said that number, so I think that's why it's top of mind.
No, that sounds pretty accurate.
Okay, good. So it's very, very small sample size. Now, I'm not suggesting I want to ask every Black woman and girl what their perception of clinical trials are, but often you do want to kind of do these studies maybe even from a longitudinal perspective, so you can see maybe let's say BDO launches a beauty and clinical trials campaign with what's a Makeup by Shayla. That's the person that's coming top of mind for beauty. And we're able to test maybe all the women who liked her post about clinical trials. And then we're able to do it over time to actually see, I think when we first asked, there was a 49% positive perception of clinical trials. And because of this campaign, it's now 62. And now 10 years from now, it's 83. You know what I'm saying? So that's sort of the limitation in terms of the data, because you're only able to capture for that moment in time versus, over a longer period of time, because then you're able to kind of see what the impact was. Are we actually shifting things, or are we kind of just stuck in the same place? Because I would hope, 5 years from now, the data does not look the same, that there are more Black women participating, there are more Black women interested, that kind of a thing. So I would say that's a limitation, but it's also an opportunity. Maybe someone listening will want to do or fund a longitudinal study, not just on Black women's perceptions, but I think all people need to participate in clinical trials. I think it's especially important for us because often when you do look at diseases, we are most burdened by them. And I think that the other piece I was going to say was maybe adding in some qualitative components. Again, surveys are very quantitative, so you're just sort of getting what, you choose this thing and then you go on to the next thing. But maybe being able to qualify it a bit more with some, patient voices or providers even, or even some investigators to talk about it, or influencers, really having a conversation, I think would have made the content or the survey richer. We have been able to more recently expand it to women across all races. Mm-hmm. And it's interesting. It's pretty much the same data. It's not same sort of stats. It's not too far off. I will say Indigenous women have a very interesting take. They were less likely than all groups to say they want to participate in a clinical trial. But when you think about the Indigenous experience here in the U.S., especially related to healthcare settings, you kind of understand maybe why they got there. Mm-hmm. So those are the limitations, but I think they are also opportunities.
Right. And I guess, as we're moving into a sort of state where it's anti-inclusion, belonging, anti-multiculturalism, how can we still, bring this message across that diversity in clinical trials still matters?
That's a really good point. And I'm glad you're lifting this up, especially in this moment. I think it still matters. And we heard this a lot at Scope a few weeks ago, that it's just good science. You don't want to have a trial or any experiment where the um, sort of the subject in the study looks the same, sounds the same. That means that you don't know if it works for other people. So I kind of lean on that in terms of, do we want good science or don't we? Like, do we want to know if it works for everyone or, it doesn't? And I think this kind of goes back to my point about data, where in my mind, like, I just bought a house recently. And
Congratulations.
so thank you. It's so much. There was a lot to do in the house, right? So let's say, the roof needed to be fixed, but I wanted a new bathroom, right? I wouldn't start with the new bathroom, right? You have to start with what is like most striking, what needs to be fixed right now. And that the data is saying that Black women represent, X amount of the population, 17 million, but make up, um, half, almost half of lupus diagnosis, but then we only have 10% of Black women enrolled in lupus trials. Well, that doesn't make sense, because the data says that Black women are over indexing in this, disease or condition. So I kind of think about it like that. Like, you have to go to where the need is, or is most needed, and then scale from there. I know we talk a lot about the side cut curb out, which was, are you familiar with this?
No, I'm not actually.
A community, I think it was around veterans, and veterans were coming back, they wheelchairs and things like that. And the curbs, were just, you had to step up on the curb. And so they created these cutouts so that people in wheelchairs would be able to roll up, be able to access the sidewalk. What ended up happening was that, parents with strollers could use it. Kids learning to ride a bike could use it, right? And so even though they created those for one community, it ended up being used for all people. So I think that's what we have to kind of apply clinical trials. It's not just about, to me, this is beyond diversity. It's just sort of, where is the need, right? And that's where we should really be starting. So I hope that anyone listening will impress that upon, our leaders, that, we are all about the good science, and also people accessing that science.
And it's funny that you mentioned the side curb cutouts, because believe it or not, a lot of people don't know that these little accessibility parts are also inclusive of DEI. That's a result of DEI.
Yes. So, yes. Accessibility, that. Disability. Like, yeah, we don't think about just those things that, because we're, all able-bodied and all of that. But when we make the world around people, I think, who might be most in need, it actually benefits us all. So,
for sure. Well said. So we're coming up on time, but I just want to thank you first and foremost for being able to come on the show. I really love your work, and I'm so glad that we were able to have this conversation today. But what do you think, the Black women who are watching this show right now, what's the one thing that you really want them to be able to take away from this?
So many things. It's layered, right? But first of all, if you don't already know or haven't read the report, please go check it out, Taylor. I don't know if it's listed anywhere, but I'm happy to drop the link in the chat later. So please go read it and share it. Number two, I would say, if you have a loved one, or you recently just got diagnosed with a condition, obviously go to BDO about clinical trials. Obviously, there's clinicaltrials.gov, which lists all of the clinical trials happening. You can search for it by zip code and that kind of thing, and by disease state. The other thing I would say is to advocate for yourself. We cannot wait around and have people come and ask us if we want to do a thing. If we want to do a thing, we have to commit ourselves to being able to get the information. I think we do it in any other arena in our lives. We have to do it for our care. So I would say, ask the questions. Use organizations like BDO, Aclinate, now included, Health in Her Hue. We have the resources. We just have to ask the questions. And I think there are a lot of organizations like BDO out there trying to make it happen. So we can do this, y'all. We got it.
Absolutely, absolutely. And thank you so much again for shouting out BDO. We have a whole clinical trials resource center where we share only the top clinical trials as well as personal stories around folks who have participated in said trials. So again, thank you so much, Kianta, for being on the show. And please tell our viewers where they can find you and where they can find your report.
Yes, so the report is on the GCI website. I think if you just search layered, it should pull up for you. But like I said, I can always drop the link in the chat. And then I'm on LinkedIn as Kianta Key. I'm also on Instagram, but LinkedIn is way more professional. So please follow me there. But yeah, thank you again for the time. I'm always down for all the things Taylor wants to do and what BDO wants to do. I'm a very big fan.
Appreciate that. And again, thank you, Kianta, and you have a great day.
You too. Thank you. Bye, y'all.